Fellow South Africans, ngiyanibingelela nonke egameni lohulumeni wethu waseNingizimu Afrika. Le dumedisa kaofela ka lebitso la mmuso wa rona. Ni mirungula hinkwenu. Le ba dumedisa bohle batho ba fano Afrika Dzonga. I greet you all in the name of our government. Tonight I address you on quite a weighty matter. I've sought to get inspiration from the wise words of our departed leader, President Nelson Mandela, when he wrote in his biography, when he said, "I have walked that long road to freedom. I've tried not to falter. I have made missteps along the way. But I've discovered the secret that after climbing a great hill, one only finds that there are many more hills to climb." That quotation is quite relevant for what we have to talk about tonight, because we have walked a long road to deal and to address COVID-19, and we've been climbing many hills. We've made some missteps along the way, but we've been climbing. As a country, we have faced two devastating waves of coronavirus infections. We have overcome these by responding swiftly and decisively, and by acting together to contain the spread of the virus and to protect ourselves, our families, and our communities. We now face another great challenge, which is another hill to climb. 12 days ago, I addressed you, and then I did warn that a new and deadly third wave of infections had begun in a number of our provinces and was spreading. The average number of daily new infections was more than doubling. Hospital admissions were rising, and deaths from COVID-19 were increasing by nearly 50%. As I address you this evening, the situation has gotten worse. Along with many other countries on our continent, Africa, South Africa is seeing a massive resurgence of infections. The Africa Center for Disease Control and Prevention reports that a third wave of the disease is underway on the continent. To date, the African Union member states have reported over 5.2 million cases and over 138,000 deaths from COVID-19. The COVID-19 virus that descended on our country in March of last year has been continuing to mutate, creating new variants. Our scientists tell us that COVID-19 has many variants. Last year we experienced what they call the Beta variant. In addition, we now have the Delta variant. This variant was first detected in India at the end of March of this year and is now found in 85 countries around the world. The Delta variant spread like wildfire in India in an alarming manner. That variant has now been detected in 5 of our provinces, namely the Eastern Cape, the Free State, Gauteng, KwaZulu-Natal, and the Western Cape. The evidence we have is that the Delta variant is rapidly displacing the Beta variant, which has been dominant in our country until now. We are concerned about the rapid spread of this variant. Firstly, because it is more transmissible than previously circulating viruses, meaning that it is easier to catch this virus through person-to-person contact. It is thought to be twice as contagious, that is, transmissible, as the earlier variants. Secondly, because it is more contagious, it can infect far more people. As with the previous variants, you can pass it or infect other people without even knowing that you have it. Thirdly, there is now emerging scientific evidence that people previously infected with the beta variant, that is our earlier variant, do not have full protection against the Delta variant and may get reinfected. Fourthly, because it is much more contagious, the measures we have so far adopted to contain the spread of the virus may no longer be sufficient to reduce transmission. There is also much we do not know about this variant. For example, it is not clear that it causes more severe symptoms. Preliminary data from other countries suggest that it is not more severe. Reports from some countries, including on our continent, also suggest that infections and clinical illness in children may be more common with this Delta variant, even as the overall rate of infection remains substantially lower than in adults. The rapid spread of this variant is extremely serious. It is for this reason that I said I address you on a weighty matter tonight. Even if it is not more severe, the rate at which people are infected could lead to many more people becoming ill and requiring treatment at the same time. We therefore need to take extra precautions. As of today, the 7-day average of new daily cases nationally has overtaken the peak of the first wave in July last year and will soon overtake the peak of the second wave we experienced in January of this year. Gauteng now accounts for more than 60% of new cases in the country. With the exceptions of the Northern Cape and the Free State, infections are rising rapidly in all other provinces. We also must remain vigilant in the Northern Cape and the Free State, which may experience a second spike of cases if the new variant spreads there as well. We must also be worried about what we are seeing unfold before our very eyes. Every one of us has a friend, a family member, or a colleague who has been infected. There are few in our country who have not had to bury a family member, a friend, or a loved one who lost their lives to this disease. We are in the grip of a devastating wave that by all indications seems like it will be worse than those that have preceded it. The peak of this third wave looks set to be higher than the previous two waves. The first wave, if we recall, lasted 15 weeks. The second wave lasted nearly 9 weeks. We don't know how long this one will last, but indications are that it could last longer. And as we look around the world, many countries have these waves. They come and they go. I know that the last thing many of you want to hear is this, that we are now in the third wave. We have all had to endure great hardship over the past year and a half. We may have thought that with life slowly returning to normal, we could take a more casual approach to the public health regulations. Perhaps we are fed up with wearing a mask on public transport and decide to keep it off for one day. When we see nobody objects or complains, we stop wearing the mask. We go to social gatherings with a mask on but take it off once we are inside. When we meet our friends and loved ones, we hug, we kiss and shake hands, believing ourselves and them to be safe. We continue to accept invitations to social gatherings and parties, and we host some of them. The difficult truth is that complacency comes at a high price. We must maintain our guard and continue to be careful at all times. Re tshwanetse gore re itlhokomele ka nako tsotlhe. Ngaso sonke isikhathi sifanele ukuthi sisibheke ngithina ngokwethu ngoba lesifo esikhona sinengozi. We must follow the public health regulations that are there for our own safety and the safety of others. Safeguarding the capacity of our health facilities to cope with rising infections is a priority. In several provinces, our health facilities are stretched to the limit, and private facilities are also buckling under the strain. Even as our hospitals have made extraordinary efforts to accommodate patients, ICU beds are in short supply. What we are seeing is that the existing containment measures in place are not enough to cope with the speed and the scale of the infections that we are experiencing under this third wave. In considering what new measures we have to take, we have drawn on international best practice and scientific data from studies across the world. Our priority is to break the chain of transmission by reducing person-to-person contact and thereby help to flatten the curve, like we did with the first wave and as we did with the second wave as well. Is made up of our leading doctors, our scientists, and our experts, and a number of them who are world-class. And also, after further consultation with our provinces and our metros, our traditional leaders, we also consulted with our religious leaders. And on the recommendation of the National Coronavirus Command Council, Cabinet has decided that the country should move to adjusted alert level 4. Is appropriate and proportionate, in other words, equal to the current situation. Additional restrictions are necessary, and we are therefore announcing this evening that we will place these additional restrictions in place for the next 14 days. And after we will assess the impact of these interventions and restrictions after these 14 days to determine whether they need to be maintained or adjusted. Therefore, the following measures are to be in place across the country from tomorrow, Monday, the 28th of June 2021, to Sunday, the 11th of July 2021. All gatherings, whether indoors or outdoors, are prohibited. These include political, cultural, social, and religious gatherings. Funerals and cremations will continue to be permitted, but attendance may not exceed 50 people, and all social distancing and health protocols must be observed. Night vigils, after funeral gatherings, and so-called after tears gatherings are not allowed. Public spaces such as beaches and parks will remain open. However, no gatherings will be permitted at such places. A curfew will be in place from 9 p.m. to 4 a.m. and all non-essential establishments will need to close by 8 p.m. The sale of alcohol, both for on-site and off-site consumption, is prohibited. Our Ministerial Advisory Committee has advised that the limited restrictions that we previously imposed were not that effective, and that a prohibition will ease the pressure that is placed on hospital services by alcohol-related emergency incidents. Because of the burden of infections in Gauteng, travel in and out of the province for leisure purposes will be prohibited. This does not include work, business, or commercial travel, transit through airports, or for the transport of goods. If you are currently not in your place of residence, you will be allowed to return home to or from Gauteng. Visits to old age homes, care facilities, and other congregant settings will be restricted. Restaurants and other eateries will only be permitted to sell food for takeaway or delivery. This is because it is not possible for patrons at restaurants to wear masks while eating or drinking in these establishments. The closure of schools and other educational institutions for the winter holidays will be brought forward. Schools will start closing from this coming Wednesday, the 30th of June, and all schools will be expected to be closed by the end of the week on Friday. Contact classes at tertiary institutions will end by Wednesday, the 30th of June, with limited access to the institutions. Residencies, however, will remain open at those institutions. The Ministers of Basic Education and Higher Education, Science and Innovation will provide further details on these arrangements. The measures that we are putting in place now are designed to allow as much economic activity to continue as possible while containing the spread of the virus. Most businesses will continue to operate at full capacity and should not be affected, as long as they observe all the health protocols in their workplaces. Our focus is on limiting social contacts while preserving the economy and preserving livelihoods. I want to emphasize that it remains mandatory, compulsory in other words, for every person to wear a face mask that always covers their nose and mouth when in public spaces. It is a criminal offense not to do so. The owners and managers of public buildings, centers, shops, restaurants, taxis, and buses all have a responsibility to ensure that people on their premises or in their vehicles or facilities wear masks. All employers must allow their staff to work from home whenever possible and should postpone all non-essential travel and workplace gatherings. Government will also be putting in place measures to reduce physical attendance of civil servants, government civil servants, at workplaces while limiting the disruption of government activities and services. As we implement these restrictions, we are continuing to work to strengthen the capacity of our health system. In Gauteng, the loss of significant capacity due to the ongoing closure of the Charlotte Maxeke Hospital is adding strain to our other hospitals. We are doing everything we can to provide additional bed capacity and speed up the reopening of Charlotte Maxeke. At present, Gauteng has made available 830 additional beds by postponing elective surgery and another 400 beds constructed with alternative building technology that are now being activated. We have been engaging with the producers of medical oxygen to increase their production to accommodate the anticipated increase in cases. We are constantly monitoring the PPE stocks and medicine stock availability so that we can intervene where we see declines in stock levels. The Gauteng Department of Health is recruiting additional human resources, that is health workers, to support increased workload. The Solidarity Fund has provided financial support to the recruitment and placement of additional nurses in Gauteng hospitals to complement the military health teams that have been deployed. To ensure that there is sufficient hospital bed space, we have to reprioritize service provision to ensure there is capacity to treat those with severe cases of COVID-19. We are forging ahead with our rapidly expanding national vaccine program. The program has picked up pace significantly, with key milestones being achieved as we move forward. As of midnight yesterday, nearly 2.7 million South Africa had received a vaccine dose. In the last week, the daily vaccine rate had surpassed 100,000. I still want to see this reaching 300,000. I've told the acting Minister of Health. In the last 3 days, we have received an additional 1.2 million doses of the Johnson & Johnson vaccine and 1.4 million doses of the Pfizer vaccine through the COVAX facility. With these additional supplies, we will be able to rapidly increase the rate of vaccination this week and in weeks that follow. In line with our national rollout plan, over 950,000 healthcare workers have now been vaccinated across the country, and the registration and vaccination of this cohort continues. The second phase of our rollout has also gone well, with the drive for the registration and vaccination of the over 60-year group continuing to yield good results. Although we'd still like to see people who are over 60 to come forward in their numbers. Whilst we have yet to reach all the estimated 5 million citizens in this group, each province has now embarked on social mobilization drives to assist our elderly to register and to receive their vaccination. due to the difficulties that they have of registering and all that. We have said they must allow people to walk in and get vaccinated, those who are over 60 and those in other age groups, as I will talk about now. To date, 3.8 million people have been registered on the electronic vaccination database. The National Vaccination Program will continue along 3 defined streams. The first stream is the general population of 50 to 59-year-olds can begin registration on the 1st of July, and vaccination of this group will begin on the 15th of July. The second stream has already commenced with people working in the basic education sector, with 184,000 vaccinations recorded to date. The third stream is focusing on police and other security personnel. The 5th of July. The fourth stream is through workplace programs in key economic sectors such as mining, manufacturing, and the taxi industry. We also need to pay attention to religious leaders who continue to serve our people diligently through counseling and through prayer. I want to call on all who are eligible to register for a vaccine, whether it is online via SMS or phone or in person, to come forward. We will continue to work with our social partners and communities to reach as many people as possible and as quickly as we can. Fellow South Africans, there is still a lot of misinformation being circulated about COVID-19 vaccine. False stories are being spread on WhatsApp groups, on social media, and by word of mouth about COVID-19 vaccine. And some of these claim that the vaccine is not safe, that it can make you sick, and that it doesn't work. Babang ba re hao o fumana vaccine ena, o tla shwa, o tla lwala. Bangwe bamba mazwipi tshifhinga tshoṱhe ngauri hei vaccine haina thuso. I've said it before and I wish to say it again. Please think long and hard before you press on your device that button to share or to send. Please consider the harm that you may be causing by spreading false information. By so doing, you are spreading panic, fear, and confusion at a time we can ill afford it. The scientific evidence before us shows that vaccines do work. They are safe, they are effective, and they do save lives. Sicela ke abantu bangaqambamanga ngale ndaba yama-vaccine. If you have any questions about the vaccine, if you are unsure in any way, please consult the information being provided by the Department of Health and from doctors. You may also have questions as to whether the vaccines currently being used are effective in preventing severe illness or hospitalization from the new variant. There is evidence that the vaccines we are using in South Africa are effective against the Delta variant. The Vaccine Ministerial Advisory Committee, which we rely on for everything that we do in terms of managing COVID-19. This committee will continue to consider all data at its disposal and will adopt its when we will adopt its advice as and when new evidence emerges. We must also remember that some vaccinated people may still become infected, regardless of variant, because no vaccine is 100% effective. Where vaccinated people do get infected, the symptoms tend to be mild. The most important thing is that any of the vaccines that we are rolling out will protect you against severe disease, against hospitalization, and most importantly, death. I also want to remind the people of our country that we must continue to follow the public health guidelines, even if we are vaccinated. Loko u kume vaccine leyi a swi vuli ku ri u fanele ku ri u famba ntsena u nga ha faki mask. Swi toda u ri naho vo tlhaviwa va dzule va tshi khou shumisa mask heinoni ngauri heinoni mask ndi yone ine ya ḓo thivhela uri ri si ḓadze dwadze heḽi hoṱhe hoṱhe. Throughout this pandemic, our national response has been led by dedicated medical professionals, healthcare workers, and scientists. And I have said, as I quoted Ubaba Nelson Mandela's quotation, that yes, along this journey, we have been climbing and at times we have made missteps, but we have been properly guided by our scientists. And some may even argue that we haven't listened to them when we should have. The news about this Delta variant, we were only told about just 2 days ago. And we've decided to act as quickly and as rapidly as possible. So we owe these professionals a debt of gratitude for their professionalism and their dedication. It is therefore extremely distressing when political leaders launch personal attacks against the professionals who know their craft, who've been well trained, who are well regarded all over the world. They are attacked for doing their job, the job that we as a nation have assigned to them. Now we have an institution that deals with the approval of all health products in our country, and they are an authority. We must remember that SAPRA is an independent regulator that focuses only on scientific evidence to ensure safety, quality, and efficacy in the interest of public health. SAPRA must be allowed to do its job without any hindrance or political influence, so that when vaccines are approved in line with the procedure that everyone follows, the public can be confident that the vaccines are safe and they are of good quality, and they are the types that will work for the people of South Africa. Since our country reported its first case of this deadly virus, we have understood that we are in this, all of us together. As much as we had hoped this pandemic will pass quickly, we know the reality to be vastly different. Some of us had hoped that it would last a year. We are now into the second year, and it may even last longer. There may be uncertainty over the trajectory of the pandemic, but there is one thing that is certain. We can and we must continue to protect ourselves, our colleagues, our families, in the best way that we know. The tried and tested public health measures that have been in place remain our best chance at fighting this pandemic. They are not complicated, they are not difficult or expensive. Whatever inconvenience they may be to us, they are certainly better than becoming seriously ill and needing hospitalization. We must always wear a mask in public. I know that people are bored with this president who continues to talk about wearing masks. He bores us and all that. But I have to continue talking about it because many of our people are simply not following the defense that we have always said can help us bring the rate of infection down. Yes, while we wait for the vaccines to arrive. And with regard to the vaccines, they are coming in now. We ran short, and we're not the only country in the world. I get calls every day from leaders on the continent about the availability of vaccines, from as far afield as the Caribbean. The entire world is crying out for vaccines, and we are doing everything we can to make sure that the vaccines are here. Whilst we do so, we must observe what we have always talked about as a defense. Wearing our masks, regularly washing or sanitizing our hands. We must always keep a safe distance from others. Unless it is necessary, we must remain at home. If you are sick and have even mild COVID-19 symptoms, you must isolate yourself, including from your immediate household. If you have been exposed to someone infected with COVID-19, you have to quarantine. If you test positive, notify the people you have come into contact with so that they can protect themselves and others. We are all responsible not just for our own health, but for the health of all those around us. While this pandemic may seem overwhelming, we can do something about it. Through the choices that we make, we can help to contain it. Fellow South Africans, we have come so far. We have indeed climbed many hills, like Madiba climbed many hills. Yes, unfortunately, much as we have weathered this storm for nearly a year, there are still many hills that we have to climb. But we have overcome many hurdles and setbacks along the way. We are standing together because we are a resilient people that has overcome the worst many times in our history. Now a third wave is gathering its own momentum and strength and force amongst our people. Once again, we find ourselves at a defining moment in our fight against this disease. Let us call on every bit of strength we have. Let us summon our reserves of courage and hold firm until this wave too passes over. We've given ourselves 2 weeks to assess precisely how effective the measures we're putting in place are. We will come back again and report on what we have observed and how this Delta variant is mutating. But I believe we will overcome. We have climbed all these hills before, and this is the one other that we must climb. We will do so by working together as we've always done. I say so because I believe in all of us, the people of our country. And I know that you will continue to do what is right and what needs to be done. And in saying this, I'm not condescending, I'm not being arrogant, I am just stating the reality. And I know that this message does find fertile ground amongst many of us, because it is this that we need to do, to observe all these health protocols. Now, Much as it is difficult, but we must never, never, ever give up. May God continue to bless our beautiful country and protect her resilient people. Nakhenza, ndiyalibuka, ngiyabonga.